Thank you for joining us today on our local health network. We have a special guest today that's going to be informing us about this new type of dentistry called teledentistry. His name is Juan Cencion, and we're really excited to hear what he has to say. Thank you, Juan, for joining us today.
Well, thank you for having me here today at your health network.
So, Juan, what exactly is this new type of dentistry, teledentistry? What is it, and where did it originate from?
Okay, so teledentistry, it's basically the use of information with technology and a way of telecommunication for dental care. It's a way to do consultations or education and to basically do public awareness of oral health. And it originated in a U.S. military base back in 1994.
Oh wow, pretty interesting. What kind of services can be performed with teledentistry?
Well, there's a couple of services that can be performed with teledentistry. Basically, like I said, we can do patient education. We can provide general patient services as far as like health and oral health care and nutrition. We can do also in-home dental services. Also, a unique thing that we can do with teledentistry is we can have this software in the ER department in the hospital, and basically we can provide dental services because patients are going into the ER and having going in with like tooth pain or some kind of dental issue, and basically the doctors are just providing them medications and just kind of like sending them their way and having them just go on and see a dental health provider around their community. And so what we want to do is basically kind of do a group conversation.
Okay.
Yeah, so the doctor and patient communicate with the dentist.
Okay.
And basically the dentist diagnoses the patient in the ER at that moment and provides the patient with all the necessary information that he needs, and basically we can get him in and provide the service that he needs for that issue that he's having with his tooth.
Oh, that's really interesting. Kind of reminds me of travel nurses, how they do home care and stuff like that. So that's like what you guys are kind of like going towards. You guys are leaving the normal dental facility and actually going into communicating out to actual patients, which is really amazing.
Yes.
Okay, awesome. What kind of equipment do I need to? What kind of equipment, do you need to perform a teledentistry consultation?
Basically, it's the simplest devices for example, the laptop or a tablet, computer, as long as it has an intraoral camera. This is the equipment that we can use to basically do a consultation through the teledentistry. As far as the cell phones, smartphones are also another way that we can do it via consultation through the teledentistry software.
Okay, I would imagine that y'all would train the patient how to use the equipment, I would imagine. Is that correct?
Yes, yeah, we'll obviously we'll do everything we can to teach him how to perform and use this device.
Awesome. Let's see. Okay, awesome. So let's go on to the next question. Where can you perform teledentistry consultations?
Like I said, with teledentistry consultations, basically as long as there is desktop equipment, such as like a laptop or an iPad or a tablet of some sort, and with the software teledentistry software, I can basically do a consultation just right in front of the desktop in such like an operatory or a nursing home, schools, prisons, or any subsidized senior housing. Basically, all you need is a desktop of some sort.
Okay, so you could essentially be at your operatory, let's say at your facility, and the patient be, for example, at a prison, and y'all would just be kind of like communicating through like a video communications. That's pretty amazing.
Yeah, so they don't have, we could just give them that consultation wherever they're located, as long as they have internet and a desktop.
Okay, wow, pretty amazing. Okay, let's go on to the next question. Let's see here. Alrighty, so let's go on to the next question. Can you diagnose a patient using teledentistry?
Um, Me as a dental hygienist, I cannot diagnose the patient,
Okay.
but via the teledentistry software, I can have a dentist diagnose the patient using special equipment, like I said, such as the intraoral or the extraoral camera, and with transmission of the high definition video, we can consult. I and the patient can consult with the dentist or a specialty dentist to assist with the patient's issue with clarity. So sometimes it just depends on patient to patient. Some patients can't be diagnosed really through via teledentistry.
Okay.
So the only way they can fully diagnose the patient is by in-person visit, which is the only way to do that. So we would have, at that point, we would have a dentist come to the patient's home and do the diagnosis there.
Okay, so that's like more like a complicated.
Yeah,
issue,
the
you know?
issues are a little bit more complicated patients and a situation. But by utilizing the cloud-based software and the intraoral camera system, I as a dental hygienist can communicate with the patient as well if I'm not present via real time anywhere there's internet connection, like I said. Which is awesome about the cloud is that it allows me as a dental hygienist to collaborate with the dentist and to view the patient's intraoral photos or videos and basically just review the medical and dental histories and any type of treatment records on a patient who may be miles away.
Okay, so you guys are basically like sharing information back and forth kind of thing.
Yes,
Okay.
yeah. Between us, we're kind of reviewing and going over their treatment. And as a dental hygienist, me and the dentist work together to provide that treatment plan that best suits that patient, because every patient is different and they all have different treatment plans. We discuss the best available option for that patient as well. So also the patient can ask any questions and get answers and have their concerns addressed via the teledentistry. Care can often be provided on the same day as well.
Oh wow.
Yeah, so this real-time process is called synchronized teledentistry.
Okay.
Yeah.
So I would imagine you know how nowadays they're using patient portals, and that patients are actually able to access their their histories.
Yes.
With teledentistry, does that allow for patients to actually log on to kind of like a dental portal that they could see like anything that needs to be done?
Yeah, that's another thing that's coming rising right now is where patients can have control of the way they view their past or current health. That basically it's like their treatment plan that they've done.
Okay.
So they can view any like type of lab work as far as medical and dental.
Okay. Awesome.
So they can just go in there and view past treatments or current treatments or future treatments that will be done for them. Yeah.
Okay.
So yeah.
Yeah, that's very interesting. You know how in the future that will help a lot with this teledentistry. Okay. So one of the next questions that I have for you is my next question is, what are the benefits of teledentistry?
Some of the benefits of teledentistry, it allows the dentist to meet in real time with the patient and who have to meet their oral health needs. And teledentistry also eliminates the travel time and reduces transportation, as far as also transportation costs. And it also minimizes time away from work or school. So these are some of the good benefits about it. Teledentistry is rapidly expanding. It's a expanding healthcare service that is being delivered here in the United States, including here in Washington. Some of the teledentistry capabilities, such as video conferencing, can expand and reach services and improve efficiency of the healthcare and any related support services by shortening delays in services and eliminating or reducing travel time and any associated costs. So these are particularly benefits the client, and which is the patient, that live like in geographical remote or underserved areas, like including urban areas. So it will really help out the patient who can't afford some type of transportation, or if it's a big cost for them.
I would imagine this would be kind of like a benefit too for like migrant farm workers, because they're like constantly traveling. You know, I know that some travel from California to Washington, so I see how y'all going to like these locations could help out the patients a lot.
Yes, it will benefit a lot of these. Like I said, there's migrant workers that come here in the area. As long as their employee has, like I said, some form of software desktop, there's modes of communication via the laptop or tablet. But yes, it will benefit a lot.
Oh, wait, that's pretty nice. Yeah, I especially hate waiting, in the lobby, to be seated and to be a patient. I would imagine this would cut a lot of that time.
Definitely,
right?
Yeah, that's another benefit of teledentistry. You don't have to go to a dental facility to go in and check in and wait, and if they're running behind time, it just goes. You just have that one-to-one interaction like instantly. There might be a little bit of wait time, just depending on like when you make a call that they have you on hold for a couple minutes or so. Kind of plays out the same way, because we are trying to help out others at the same time, but it's not as long as going to the dentist and having to wait if they're running behind time.
Okay, perfect. Alrighty, so Juan, the next question is teledentistry HIPAA compliant?
Yes, our teledentistry is HIPAA compliant. Any dental or medical devices and its technology used for teledentistry must be HIPAA compliant and legally perform teledentistry activities. What it does is the data gets input into a secure cloud system.
Okay.
So it's pretty secure.
Okay.
And it's HIPAA compliant. So.
Okay, that's very, very good, because I would imagine patients would be kind of afraid of what could, like, anybody hacking into their information with all these new internet, internet viruses and people out there trying to steal sensitive information about patients. So that's really, really good.
It's the same with patient portal. It's protected by good software, and we have some pretty great technology savvy
like IT
people.
specialists?
Yeah, IT specialists that are always on the watch.
Okay, awesome. That's pretty awesome. Next question is, how does this impact patient care and dental hygienists at your workplace, or let's say in the future for your role?
Okay, so, basically, patients are receiving their dental care that they need, especially people living in the rural communities. They're always basic, they're basic people, obviously, and sometimes it's hard to get off of work. So this makes it that they miss less work. It also, like we mentioned before, is just they're waiting less at their appointments, and they also save gas money. So it's another positive thing. So as far as how it's impacting us as a dental hygienist, and we get more independence to perform any type of dental procedures with less supervision by a dentist. For example, we're becoming more like an ARP who get to practice without much supervision by a doctor or by the dentist in this case. As a dental hygienist, we also like to establish like, a great communication between us and the dentist. Also, in 2017, they passed a law where we as dental hygienists, before we were allowed to we're allowed to administer, we are allowed to administer local anesthetic, but the only way we can administer the local anesthetic on a patient is by the doctor being present within the facility. But now this new law that passed in 2017 allows us to administer the local anesthetic without having the doctor or the dentist be present or within the facility. So that's another thing that has progressed, and we're really excited that we as dental hygienists are getting to be more independent. Hopefully in the future we will also see hygienists in hospital settings where patients are recovering from disease or some kind of major surgery, or they're basically immune compromised patients that they're there for a long time and their oral health is poorly managed, yes. And so that's like the last thing they worry about. The first thing that's priority is to recover from whatever thing they're going through, and the last thing they forget about is their oral health. So when I was as a student, we learned that basically your mouth is the window to basically your body, and so whatever is going on in your mouth is being reflected on your body. So by them having poor oral health and not managing their mouth by simply brushing or flossing, it's being seen by the disease that's going on throughout the body, through them. So we want to get that going, hopefully in the future soon, that we can provide them with prevention, and so it's something that's really important. I believe that they get the care they need. So yeah.
Oh, that's awesome! I'm really excited for this. That they're going into the hospital. They're trying to get you guys to go to the hospital. That's really.
Yeah. So that's what hopefully in the near future will holds the next thing for us. Besides the teledentistry, yeah. Okay. So it would be a great step.
Well, thank you so much, Juan, for your time. We really appreciate you coming into our facility and interviewing you.
Well, thank you for having me.
Oh, thank you. Alrighty, you guys. Till next time. Thank you for joining us. Thank you for joining our health network, and we'll see you next time.